Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today by my very Mary co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
Are you thinking I'm a Maori?
Did you get the May reference? It is May.
May 1st.
It is May 1st. I feel like we just recorded the episode last year where Nils made me a Dutch girl.
Yeah.
What I would really like to be this year, though, is more of like a Dutch, like, I think a Dutch fairy, like with a flower crown and like, yeah, dancing around the maypole.
Yeah, it's so funny because like May to me is the Derby every single time. We talked about this last year.
Yeah. Yep. So you're just waiting for
horse racing and betting.
Horse racing and betting.
And debauchery.
Well, for whatever your May plans entail, whether it be dancing around the maypole or debauchery, I hope that the May goes well.
Yes.
Before we get into the episode this week, Dr. Martin, just to remind everyone, if you are not watching this episode and you would like to, you can find us on all social media at Jason Martin MD and at Beauty and the Surgeon Podcast. We're also on YouTube where you can see us videoing, audioing,
and hear us.
Today, we're doing part 2 of our Everything You Need to Know About Arm Lifts or Brachioplasty episode. If you did not listen to part 1, it's important to go back and listen. We're going to talk about how to choose a surgeon, the risks and complications that are potential with this surgery.
Questions you should ask, which are always really important.
Yes. So that one's important. Today, we get into, I always feel weird calling it the meat of it because that just sounds creepy when you're talking about surgery, but the specifics of surgery.
It does kind of
right.
push out.
Yeah. I found something on the floor this morning. I'm like, this looks like an oat, like an oat. And I'm holding it in my hand and Catherine's kind of staring at me. I'm like, well, I know it's not face, which Nils laughs because
it's possible.
I picked up something that I thought was a piece of pretzel off the floor one day and it was face. So, when you're...
See, this is what they want to hear about for the podcast.
That's what I know. Everybody loves to hear about that. So yeah, if you're picking stuff up off the floor in a surgeon's office, just know that it could be pretzel, it could be face. You don't know until you pick it up.
Yeah. With Nils's facial of human fat, that was probably took the cake.
It was on his shoe. It was only on his shoe, and I wiped it off.
All right, let's do part 2.
So we're first going to talk about what to expect at your pre-op appointment. So your pre-op appointment, there definitely be pictures taken. Lots of pictures of your arms up, your arms down, your arms straight out, stop sign arms, arms out to the side. Lots of pictures of your arms. These are part of your medical history. We're also going to go over your health history again. Dr. Martin talked about why this is so important in part 1. It's very important. So any of the things you may have forgotten to include in your health history.
We're going to go over your labs and EKG for sure. So you're going to get an EKG if you're getting general anesthesia and you're over 50, at least in our office. You'll also get an EKG if you have any kind of heart history. So labs are just basic labs, but we definitely want to look at your platelets, your hemoglobin, all
Clotting
those kind
factors.
of things. Yep.
Those are key. Well, have you signed consents, collect the final payment, give you your prescriptions, pick up your prescriptions before surgery.
So you couldn't even say it.
I know.
It was so difficult.
It's like, I don't understand why people don't pick up their prescriptions.
And I always tell the story, but when you come out from surgery, you just knocked it out of the park and the nurse is like, well, they don't have their prescriptions. I'm like, oh, they do. They have their prescriptions. They just didn't pick it up.
They didn't pick them up.
And the nurses are like, no, Dr. Martin, you don't know what you're talking about. I'm like, I know what I'm talking about. 100%. Those prescriptions have been called in.
Well, now we e-prescribe, so we can actually prove it, but it doesn't even matter.
It doesn't
pick
matter.
up your prescriptions.
If you didn't pick them up, just go pick them up.
Pick them up.
I just heard a story from one of our local comedians who had the ear surgery.
Yeah.
Oh, an otoplasty.
Otoplasty.
Come on,
when
you
he
know
was
the name.
younger.
Yeah.
Mom forgot to pick up his prescriptions, got home, anesthesia wore out. He said it was one of the most painful things he'd ever experienced.
Waiting for the prescriptions.
Yeah, he's probably 10 or something when it happened.
Oh, poor guy.
Yeah, I was just like, that's why you need the helper to remind you too.
Yes.
Go get him.
And I'm joking, but you don't want the patients to be in pain.
No.
So, which is why the nurses in recovery, thank God for them, are like, look, they need their pain medication before they go.
Yeah. Collect the final payment. I already said that. Talk about the day and time of surgery. Answer any questions. This is a good appointment to bring your caretaker to. If they, that way they can get their questions answered as well. If not, just make sure that you do have them review your post-op instructions prior to surgery so that they're not reading through them like in a mad panic when you're, in pain right after surgery. Like, is this normal? Like, oh my gosh, make sure they read through this as well. Yeah.
You have an incision on your arm. What is going on?
Or what is this drain? There's just things. So what are some good questions that someone should ask at their pre-op appointment?
Yeah. Where do you go after surgery? Really good point. What's the situation after you wake up from surgery? Where are you going to be? What medications will you be prescribed? Will there be pain medications, antibiotics, muscle relaxers? Will you have dressings and bandages? Almost all people doing a brachioplasty will
I love
have...
how you just left out drains.
Yeah, drains. Yeah, that's like talking about politics, But the dressings, almost everyone uses dressings, and it's usually an ACE wrap of some sort. We use drains. They're very helpful. They're only in for a short period of time, as we said in the last episode. And I would assume actually most people do for this surgery.
Yeah, especially if it's a full brachioplasty. I would think most people do.
Right. Yeah. Drains are removed at day 3 to 5, usually somewhere around there, maybe sometimes 7 days. Some surgeons will let you shower right away. Even with drains, we usually wait until the drains are out. And you can drive when you're off pain medication for at least 48 hours, but it would be hard with drains. So you might want to wait until the drains are out before you do drive. And when can you return to normal activities and exercise? That's such a loaded question. I'll let you answer that, Amy.
Well, we were going to talk about that in detail when we talk about recovery.
Got it.
My favorite is when someone, will be telling me like, not with a brachioplasty, like just when they surgery, that they're like in all this pain and they can barely move. And then the very next question is, when can I go back to golf? I'm like, you literally told me you couldn't walk to the bathroom unassisted. But you want to know when you can golf again.
Yeah.
Like as soon as you can walk to the bathroom.
The tell, there's like so many tells with patients. Like again, we love patients, and this is not a criticism, but they're like, I'm in so much pain. And then you ask them about sleep, and they're like, I slept pretty good, like 8 hours. Like people don't sleep when you're in pain.
Oh, see, I always ask people about sleep first for that reason. Like, did you sleep last night?
Right.
Yep. Mm-hmm. Yeah, because if you did, that's awesome. Yes. If you did not, then we got to talk.
Yeah, we got to talk.
So those are great questions to ask. And again, this, like I said, is a great appointment to bring your caretaker to, because they may have questions that you didn't even think about. So
one other thing, I think it's really important to talk to the surgeon again, exactly where the scar is going to be. Have them draw or point on your arm to show you and your caretaker exactly where that's going to be. Have them show you exactly where the drain's going to come out. And, I think that's going to be really important. So you're mentally ready.
Yeah. It really alleviates a lot of like anxiety for the person taking care of you if they know that ahead of time too. So that, it can be hard. Being a caretaker is not easy. Catherine found that out when her dog had to have surgery last month.
You found that out just working with me for 100 years.
Well, yeah. And just in general, like even before that, I had all my family members are prone to injury. So I've taken care of a lot of people from injury.
You are a natural caretaker.
Yeah. So yeah, your caretaker, they make them as informed as possible too, because then they're not worried unnecessarily. All right. Dr. Martin, this is your slide.
Oh, this other stuff was so boring.
Let us talk about the surgery.
All right. So anesthesia, most cases could be general anesthesia. That's a tube in the back of your throat. That could be a laryngeal mask or a tube that actually goes through the vocal cords to help you breathe. Some sort of sedation through the IV, most likely propofol, maybe general anesthesia, which is an inhalational agent that you would breathe in, but most likely just propofol, a very light general. We can also do these under local anesthesia. Amy said this before in the previous episode. That's usually a mini, not a full, but you can do a full under local. It's just a lot harder to do for the patient. If you do anesthesia, you do.
I was going to say.
Why does that always make
if you do? Where is the doo-doo bird?
Yeah, I don't know.
A bird. Let's pop up a doo-doo.
Right.
If you do.
Anyways, by the way, I just read an article. They're like rejuvenating or bringing back all these extinct animals now because they finally have the technology.
Like dinosaurs? Oh my gosh, is this Jurassic Park?
No. The first one they brought back was a dire wolf, which is basically from Lord of the Rings. Or no, from...
Game of Thrones.
Game of Thrones, excuse me.
We were talking about that this morning.
Yeah. So they brought a dire wolf
mixed
back.
wolf genes in with the missing DNA and everything.
So they brought a dire wolf
Park
back.
Cool.
Well, maybe they'll bring me back in 1,000 years. We'll see.
We'll do it.
Yeah. Anyways, so you go into the hospital, you see the physician in the preoperative area or his office or a suite. He marks you or she marks you on the arms, and then you get rolled back and they administer anesthesia. So in almost all these cases, at least in our hands, you're going to have liposuction and also the brachioplasty. So to initiate the surgery, you're going to make small stab incisions,
First you're going to numb it.
Yeah, inject the tumescent fluid, for numbing purposes. And Amy, tell them why it's important to get numb even when you're asleep.
Well, because your muscles or your nerves will still respond to pain, even when you're sleeping. And that's why, depending on the extent of your brachioplasty, they may recommend general anesthesia, which freaks people out, but it's just so you're not moving around as much.
Right.
Like you can use less other things if somebody is not responding to the pain.
I mean,
even in
I'm
their
super
sleep.
ticklish in my armpit area, right? So I don't know if I could sit still with people manipulating that area.
Right,
Super
because
ticklish.
even though it's numb, I mean, that's the thing about numbing or tumescent numbing is that you can still feel the skin in a lot of cases.
Yeah.
So like if Dr. Brenner will put like a cold instrument on a person's abdomen, let's say, like if you put a needle driver down, like they'll feel the cold on their skin, but they're numb.
Yeah.
So it's like, how can you feel and be numb at the same time? So the ticklish thing, that's actually a great point. If
Yeah.
someone was like unbelievably ticklish.
Oh, I could not do it.
Yeah.
Are you
'Cause
ticklish?
I'm more irritated by people trying to tickle me. So like, yes, I feel like everyone is ticklish, but like things like pedicures, oh gosh, like my feet are so sensitive, like it like creeps me out the whole time.
The one pedicure I ever got, it was right before we got married. We had no money at the time. It's a long time ago, obviously. And my wife was like, I want you to come with me and get a pedicure. I was like, I really don't want to go. And she's like, I really want you to come. And I went there and I didn't get the nice, soft-handed lady. I got the brutal man who treated my feet like he was angry at the world. And it was the most annoying, terrible experience of my entire life.
See, and I'm actually better with that because it's the creepy light touch, like that tickly kind of touch.
I didn't want him to be angry at my feet.
Oh.
I wanted soft, nice.
See,
And
the
I
soft
didn't
nice
get-
is tickly.
Okay.
Yeah.
Anyways, so we're going to make the incision. After we do liposuction, we inject tumescent fluid, which is a numbing fluid. We do liposuction, and it's really, if you put your arm out, if you're listening, if you're watching on YouTube, put your arm out. The liposuction is usually the lower part of your arm with your arm straight out. So it's like almost 180 degrees, the lower part of your arms. You don't usually lipo up where your biceps are. Right. Sometimes you'll lipo where your deltoid cap is, which Amy has big ones now. But most of the time it's the underneath the arm. It's actually the stuff that kind of sways back and forth.
Well, and also the elbow. And I think that's a really important part because, a lot of people have skin that when their arm is down, it kind of like drapes over that elbow, but there's also fat there. So to avoid having to extend the incision like way past that, you can sometimes just feather that in with lipo.
Yeah, lipo is really important. So I think lipo is actually critical to this surgery, just so you know.
Well, it also kind of elevates everything up too.
Right. After lipo's done, we make our incision. So we're going to just talk about a full because the minis can have different types of incisions. Last episode, we talked about a video you should watch on our YouTube channel, Jason Martin MD, which really shows you the different types of incisions. So a full incision goes from the armpit to the elbow. It's in that brachial groove, the space between the biceps and the triceps. Amy, when she goes in the mirror like that, she can really see her crease. Some people may not be able to because of too much fat or loose skin. And that incision is completed, and then you elevate a flap after the incision is completed. And elevating a flap, how would you describe what that means, Amy? So
well, that's what I mean. The lipo kind of does it. It just creates space.
Right.
It creates space between the skin and the underlying
and then
tissues.
muscle and the fascia. So you're separating, that's a really good way to put it. You're separating the skin and soft tissue from the muscle and the fascia. Now, FYI, the things of importance, the nerve usually, or in almost all cases, run underneath the fascia. So as long as you don't violate the fascia and violate the muscle, you're not going to hit that nerve.
The big nerves.
And the nerves are the nerves that are necessary primarily for sensation. If you went hog wild and you went to a terrible surgeon, you could maybe hit the nerves that are needed for movement. Those are deeper, or you could hit the artery and vein, and that you could die. Yeah. So I just want to be really honest.
I know.
Is there a better way to say that?
No, but that's true. Yeah.
You could exsanguinate.
Yeah. Again.
And then die.
Risks of surgery are still risks of surgery.
So, but this is not a high risk procedure. So you're separating the skin and soft tissue from the muscle and the fascia. And then what you do is literally just remove the excess stuff and close it.
Well, you bring it all together too. And I think that's part of it that makes your brachioplasty so good. We do a lot of internal suturing, but you're bringing, the fat that is left back to a place where it's more aesthetically pleasing. It's smooth. That's why you don't get those weird ripples and bumps, because you actually bring all that tissue back to where it should be as well.
Right. You will put in the drains, redrape the skin, remove the excess skin, put the deep sutures in, which is a superficial fascial system or whatever you want to call that deep layer, and then put some external or some superficial sutures in right underneath the skin. Almost always I run it underneath the skin so you don't have a lot of external sutures. I will, in many cases now, put staples to reinforce the suture line that come out really early so you don't get the track marks and stuff. But the staples are really reinforcing for the first couple of days. They also are a reminder when you do something stupid, it hurts because the staples pull.
Yeah, they don't let you move.
Yeah, so we'll keep those in for 4, 5, 6 days and then pull them out. And that's really it. You may or may not have stereo strips on there. Again, it is very hard it's so funny. You try so hard to be good at this stuff and then you become good and then you realize how impossible this stuff is. So it's almost impossible to make the tightness on one side equal to the other. To mimic exactly what you did on one side and then remember from a proprioception standpoint with your hands and your brain to figure out how you do the same thing, which is all these other complex steps on the other side. And somehow it works out. So there's something inside of me or people that do this all the time that allows you to get that pretty close. It's never perfect, but pretty darn close. I mean, pretty close.
Oh, yeah.
Yeah.
I mean, again, there's always going to be differences side to side in people. So,
but those differences are so negligible and minimally evident. We've never honestly ever had a patient come back and say, "Oh, I think the one side's good, the other side's bad."
Nope.
So, but that's the risk of this surgery when you have bilateral surgery. We've seen people with breast lifts. And one side, I'm like, I don't even know what happened on the other side when they did that. And it was an R patient. And I was like, I have no idea what they did. So that mimicking of what you do from one side to the other, that ability to ensure symmetry from one side to the other is really important, besides just removing skin and soft tissue.
And part of that too, something that I see so much in you is your preoperative markings make such a difference.
You know what I see in you? You're a nice person.
Thank you.
Yeah, no problem. That was really sweet. What I see in you.
Yeah.
I felt like I was talking to my mom.
But my point is, I see a lot of other surgeons who maybe don't have great outcomes. And a big part of that in anything you're doing on both sides of the body, I think really you take it down to a really basic level. Let's take like probably the most basic surgery that people do, like lipo. Yeah, like that's going to be where your most notable issues are going to be side to side if you can't do that.
Oh, the lipo that you start with is probably the most important part of the whole surgery. I was trying to explain this to the fellow because removing the skin and soft tissue, we do that all the time. We'll do it on the face. We'll do it on the belly for a tummy tuck. We do it on the inner thighs for a medial thigh lift. So everything we do is removing skin and soft tissue and making it symmetrical from one side to the other.
Yeah.
The only reason that it's so obvious with arms is when you put your arms out, you can just look in the mirror like this.
You can see it.
It's a lot harder with your breast or your belly or
even your legs.
Or your legs to kind of see the symmetry. But it's really easy with your arms. And liposuction is super critical. I saw a patient that had a brachioplasty and they didn't lipo her, and I was bewildered. Like, why would you not? I mean, it's so odd. So she really had heavy arms and just tightened skin. I'm like, what's the point of even doing this surgery?
Right, you just have big arms that are tighter.
Yeah, that makes no sense. Yeah.
Well,
sometimes I want to pull my hair out. Like, plastic surgery is not difficult. We talk about this all the time. It's really
it is difficult. Yeah.
No, but the principles of it are really straightforward, and then the
execution
is hard, but then once you get good at it, it's pretty simple then too. So the hard part is trying to figure out what these people really need. But you don't have to, anyone can figure out for an arm, you need to reduce the fat and tighten the skin at the same time.
Yeah.
That is not Nils knows that.
I think that's really where the art comes in that maybe you even take for granted, Dr. Martin.
Right. Exactly.
I love drawing, and of course Sarah's an amazing artist.
Yeah,
but
she's amazing.
One of the hardest things to do is that bilateral symmetry. Like, I would always draw my superheroes, one arm different than the other, one foot different than the other. Like, getting that, like, mimicking, that to me baffles me. And doing it on a person, that's just a whole nother level.
Right. And you almost have to definitely in the OR, you let go a little bit.
Yeah.
And you have to get into that flow state. I'm more creative. You guys know that. So I'm more creative. But I will tell you, so I love to draw. And when you draw things that you already know what they look like, it's really hard to make them symmetrical, like eyes. Like eyes or ears. It's really hard to just draw those freehand. So I showed this trick to my son the other day because he's starting to draw more now. I said, just turn the picture you're drawing upside down. So what that does is trick your brain into making it think it's something else. Like, it's eyes turned upside down, the face. Do you know what I'm saying?
Yeah.
And it takes away whatever that barrier is that you struggle with. And surgery is the same way, right? So surgery, if you get the music on, you're in this flow state, then it goes away. But that symmetry thing, 3-dimensionally speaking, is so hard. It is so difficult to get 3-dimensional symmetry. And it really does take a nuance, a creativity, technique, ability to say it's not right. She's seen me do this many, many times. You look at it and you're like, I got to do a little bit more. That's my facelifts are all like that. It was so funny. I was doing a facelift today, and the scrub tech was like, I've done so many of these with you now. I get it. You're always going to need that little scissors, which is the little scissors just to make that.
The curved sharps.
The curved sharps, yeah, just a little bit better. Yep. And she's like, and you always do it. You do something, and then you come back to it, curved sharp, blah, 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 right? And every single time. And she's like, I get why you're doing that now. You want to make it perfect. And I was like, yeah, but always tailoring, always tinkering, always doing that kind of stuff. Brachioplasties are definitely that way.
Yeah. Well, the point I was getting with the lipo too, if you over liposuction one side versus the other,
oh, it's terrible.
You can't go back and put the fat back. So that's where your ability to mark and to do that very foundational part correctly sets you up for success where others might falter.
And in my training, that's what you saw, that they would do aggressive liposuction that was asymmetric. The patients would be super swollen afterwards,
right, well,
and they would take too much skin out.
Right, or not enough or something, like because the swelling.
Yeah.
If they were doing super aggressive lipo, then it's all swollen.
Or vice versa, not enough. And so you would always have these patients. I remember one patient had to stay in the hospital for 3 days with their arm elevated. And we had to check pulses on her.
Because they sewed her so tight.
I don't even know what the hell was going on.
Oh, gosh. Yeah. So
this is a long time ago. I don't want anybody to be freaked out.
No, but this is why.
I'm old.
Listen to part 1. Know how to choose a surgeon. Yes.
Yeah. I don't want to make this episode about me, but I do think that brachioplasties.
Well, you are the surgeon.
I know, but
it's in the name.
I get it. But brachioplasties are very much technique driven, and like facelifts, brachioplasties has that finesse thing that Nils is kind of referring to, where you have to really inset it nice and it's 3-dimensional like a facelift.
Well, it also is a mobile part of the body.
Right. A tummy tuck's a little bit different because it's kind of straight down. You know,
it moves
you kind
in
of
one
just
way.
pull as much as you can within reason. Whereas the brachioplasty is very nuanced, just like a face and neck lift. You can't pull too tight with a brachioplasty because the incision will break open. Yeah. You can't make it too loose. And then it also has to be the same amount of tension all the way through that long line, which is probably, I don't know what it'd be in inches, like 18 inches long. So everything has to be the same tension all the way through. So
yeah, there's a lot going on with brachioplasty.
this is sounding overwhelming. I don't know if I want to do this surgery anymore.
I'm thinking about it.
Yeah. So then
you guys got all up in my head.
The very final step before you're awake from surgery is the surgeon's going to probably use ACE wraps to wrap the upper part of your arm.
And everyone's going to pat me on the back. And so, way to go, Dr. Martin. Another success.
Yep, no high fives because you can't put your arms up.
Right. You have to pat on the back. Yeah.
So, you'll be wrapped with ACE wraps, probably some bandages, and of course, when in your pre-op appointment, you found out when you can take all those things off. All right, so let's take a quick break. When we come back, we're going to talk about recovery.
Awesome.
And we're back. This is where I think the most important part of all of this as the patient, this is where the patient needs to shine in the post-op recovery period.
You shine bright like a diamond. Amen.
Yes. So the biggest thing you can do before you're a day, leaving the surgery center, prepare for recovery before surgery.
Oh, I love this.
And this includes reading your post-op instructions and reviewing them with your primary caretakers.
What about a recovery station? That's my favorite word to use.
It is. Yep. Yes. So you should also know where your first post-op appointment will be.
It's usually not at the surgery center or the hospital. Most
likely not. Unless that's where you've had all of your appointments, I would say it's probably guaranteed that it is not.
Yeah.
Fill your prescriptions. If we didn't say it loudly enough in episode 1, we're saying it again. Fill your prescriptions. Purchase recommended post-op products. This is what Dr. Martin was kind of alluding to with his post-op recovery station. So that might be ice packs, garments, pillow systems, supportive anything.
Nerd clusters, maybe?
Mm-hmm. Tasty treats. Consider purchasing support pillows to facilitate better sleep. This is really key because, your arms need to be elevated, and you're probably not going to want to sleep on your sides. So you're probably going to be requested to sleep on your back at a slight incline, but you also don't want your arms just hanging down at your sides because then they're going to be really low. So having an ability to kind of almost like you were, have pillows under your arms to support them.
I've never even thought about sleeping with a brachioplasty. I mean, I guess you could go a little bit lateral, but not much.
Not a whole lot. And either way, they need to be slightly away from your body.
Man, I could never have surgery.
Yeah, so there's a lot to think about.
I know.
Yeah, there's a lot to think about.
I have to medicate myself so bad.
It is a short time period, but that's why things like these pillow systems can really help make it just as comfortable as possible. Mm-hmm. And just having a lot of options. That's what I really encourage people, have a lot of pillows, have a lot of options. You're going to find a way that's comfortable for you, but being more prepared, like get as many pillow options as you think you ever might need. Yes.
Who doesn't love pillows? Like when people make fun of you for having all these pillows on your bed, I'm like, that's your problem.
Right, like I'm sleeping like a baby.
Dude, if the more pillows, the better. I wish the whole bed was a pillow.
Yes.
This pillow bed. I mean, don't you agree, Nils?
One for every crevice. So
yeah, exactly. I know. I'm stuffing pillows everywhere.
See, you'd be right. You'd be all ready for recovery.
Comfortable.
This is a really key thing. Think about the things you use on a daily basis and move them as close to waist level as possible. People often think about things that they need to reach up for, but they don't tend to think about things that they maybe reach down for. And
abajo.
Is that down?
Yeah. Arriba up, abajo down. Yeah.
Yeah.
So if the down part could be sometimes worse than the up part, right? I mean, I guess you could technically kind of do a one-legged squat. Yeah. Or two-legged squat, but that's hard after surgery. And so you're inevitably going to kind of bend down and grab, which is going to be more of a problem than slightly reaching up.
Yeah, if your favorite dishes or your favorite pot is really heavy and it's on the bottom shelf, way low down, you have to think about those kinds of things.
Yep.
Or even like showering too. A lot of people have stuff on like low shelves in the shower. I'm like, just as much as you can, get everything as close to like that you could reach it with your elbows attached to your sides as possible.
Right.
Without having to like really manipulate yourself. Plan on a few days of loose, button up, easy to put on clothes and shoes. Slip-on shoes here is really key because, again, the bending down and like doing things like tying your own shoes is not going to be something that you're going to love to do for a few days, especially the day of surgery. When you have the drains, they obviously, for us, they're going to come out at your elbow. So you're going to need to have something that you can get all that through. Now, if it's summer and you can wear tank tops, great. If it's winter and you got to put your arms through like long sleeves, you need some loose sleeves.
Yeah.
And just easy to put on clothes. You can't wear anything where you're having to stretch your arms up overhead to put it on.
So you got to zip up.
Zip ups, things that are easy to put on are very
very loose. Think B-boy in the 90s, real big and baggy.
Tracksuit.
Yes. Oh, Nils, you got to put the tracksuit picture here. I use those pictures all the time. Those are my favorite emojis to send people.
She sends me those emojis all the time.
Oh my gosh, I love them.
We still got to make them, I know. We got to wait for the tariffs to go away so we can start producing
we can import
them.
Yes.
A non-United States location.
Yes. So, the clothes, just easy to put on stuff. I always tell people to things that you maybe don't care about a whole lot because you might be leaking a little bit from some areas. If you had, liposuction, sometimes it can still be leaking out of like the back area.
Even with the drains. Yeah.
Yep, even with the drains, it can still leak. So, or even around the drains, just because they are dependent, you can still have some leaking like around the drain. So just the first couple of days, just think like stuff you don't really care about or that it's not white or it is white so you can bleach it like dark, or that's why I'm like everything needs to be black or white because if it's black, it's going to cover blood. If it's white, I can bleach it out.
I can tell you this. I don't know how you are, but Barb just got new sheets. If I'm getting a brachioplasty, she's not letting me go anywhere near that bed.
Is it white?
No, they're kind of an off color, but like she loves those sheets way more than my recovery. I can tell you that.
Yes. All the sheets in my house right now are black because, I have the show tan on. So.
Oh yeah, that's smart.
Yes.
Yeah, you could get like a pair of black sheets. That's really smart. I didn't even think about
dark
that.
Colored sheets, or just like throw a towel down under yourself when you go to sleep that first night.
Oh my God, no way.
Yeah. So it's normal to be nervous and excited. These are normal things.
Yeah.
It's still surgery.
It's still surgery. Yeah. And you guys are awesome. I mean, there's nothing, this podcast is so fulfilling for all three of us. We get your input. You're going to surgery. You're nervous about this. You feel better because you listen to this and that kind of stuff. Being nervous, having concerns, but also being excited is normal. And you should embrace that. That's great. Hopefully these kind of resources will help you gain confidence before you go in and obviously afterwards with the recovery.
Yeah. All right. So now we're going to kind of break down like what to expect during recovery. So initial recovery, your arms are going to be swollen. You're going to have discomfort. You might have some swelling of the lower arms and hands. Now, again, that
right away you might have that.
Yeah. And even the first, couple of weeks, you might feel like you're a little bit puffy in the lower part of your arm. However, if you're having significant swelling and or pain in your hands or arms, you definitely need to let your surgeon know. Bruising, from the lipo can be normal. Even just like a little bit of like reddish, like kind of mottled, almost rashy looking is sometimes like just that tension on the skin can look a little bit weird. Mm-hmm. Temporary numbness or changes in skin sensation, you should expect this. Like there will be areas that are numb.
So that numbness is around the area of surgery. If you have numbness is radiating down to your hand, that's a problem.
Different. Yeah.
That's different.
Yeah. Just
again, we're not your doctor. So if you have any kind of problems, always contact your surgeon. But numbness around the area of the incision is expected because you divide that skin and soft tissue and all those small nerves that go up to the skin.
And all the areas that had lipo for sure are going to be kind of weird feeling, like almost kind of
Woody,
tingly or
like
hot.
wood, or like wood.
Yeah. Like that you can, like when you're touching wood. Yeah. Like that's people are like, it's like I'm like, yeah.
Touch wood.
Yeah.
How many times? How many more
Steel.
times can I do that joke?
Yeah. You've done steel.
I mean, I do that every single episode. I got to get some new material. Like Nils was talking about, people don't have material anymore. I got to work on my material. I got to go on a writing retreat, really kind of work through the funniest I'm going to say. Because you only laugh maybe 25% of the time.
Well, I mean, I shouldn't be laughing all the time.
You have a nice smile and nice teeth. Like if you would laugh, we would look good, right? But you look over at me like, what are you saying, jackass? That's what you think sometimes.
Well, laughing's my job. So.
Exactly.
That's true. True.
Nils is here for the comic relief.
You're right, Nils. You're like the backtrack crowd noise laughing. Yeah.
Like the old sitcom, audience track.
He's the audience. Yeah. Let's cue the laughing sign. On air.
Yeah.
So week 1, so that first week after surgery, you're going to have limited use of your arms and definitely some lifting restrictions. And when I say use of your arms, I mean more like the range of motion of your arms is going to be limited and your like lifting restrictions. For us, unlimited easy walking is absolutely key. It's going to help
walking
with
super
recovery.
important, that we say every time.
Yep. And allowing your arms to have like that natural movement with your gait is also really important. Yep. When I say limited use of arms, like I don't want you walking around like stiff as a board, like that's not it.
Like Frankenstein. No,
right.
It doesn't work that way.
You want to let your arms have some, natural movement because it's going to help with lymphatic flow. But it is, your range of motion might be slightly limited. Well, it will be limited. Pain medication, maybe 1 to 2 days for most of our patients on prescription pain meds, if that. The arms, because they are more mobile, they don't tend to be as painful as a lot of other surgeries that we do. They're sore for sure. And there's incisional like stinging and kind of pain.
Well, I mean, technically speaking, if you do it correctly, you shouldn't get into the muscle. Muscles is what always hurts for people. Tummy tuck hurts primarily because of the diastasis repair. Breast dogs hurt because the pectoralis muscle is violated. So,
thigh lifts just suck. That's why they hurt.
Thigh lifts really are sometimes less painful and just more annoying.
They're just annoying. That's what I mean. They just suck.
So brachioplasties are somewhere in the middle. They definitely hurt, but it's not terrible. I mean, in our experience.
Well, just irritation, but most people switch to Tylenol within a day or 2 of surgery.
Right.
So that I would expect that. Maybe some muscle relaxants just to kind of help you relax, help you sleep better. As Dr. Martin mentioned, he would have trouble sleeping in that position. So, some help with sleeping perhaps. Compression shirt or sleeves once the drains have been removed. While your drains are in place, it's going to be hard to put anything tight on your arms because the drain is in the way. So you might be wrapping with that ACE wrap for a couple of days, but it is important, again, follow your doctor's instructions to not continue to ACE wrap once they tell you to stop, because that ACE wrap can start to kind of dig in and cause weird irregularities.
It can definitely cause contour issues.
Yep.
Yeah.
So you want to have smooth compression, at least for us. So when you're told to stop wrapping, there's a reason why they told you to stop wrapping and switch out to your smooth compression.
And your surgeon may do a compression garment right away, which is totally fine.
Yep. If you don't have drains, you can put it on right away.
Yeah. And you can do it with drains. It's just harder.
Yeah. I mean, again, you got to be really careful. I mean, that might be the case. They might put you in it and then help you get it off the next day kind of thing if they did. But you would definitely need help with that. Most people can return to, I say most work within a week. The caveat to that would be like if you do a physical job where you have to lift or use your arms a whole lot, or like I always think of people like transferring patients or stocking store shelves or something.
The crosswalk guard, right? When you're holding your hand in the air.
You could hold it low.
Kind of out.
You just need a longer stick.
I'll think of some jobs they can do. Okay.
Yeah. So they're, being like, the nice part is it's a hidden surgery essentially.
Okay. What if you work at a German beer hall and they carry those trays full of like 20 beers? Have you seen these when they stack them up?
Sometimes they don't have trays. They have like 6 pints in each hand.
It's insane. I watched I got stuck on YouTube for an hour.
It's very cool. Yeah. Like Oktoberfest, you see them come through the audience and they're holding like 20 beers.
I don't think you could do that after a brachioplasty.
No. In fact, we actually have had a couple of patients who have either worked in grocery stores or who work in restaurants, and those are some of the longest times to go back to work because of that. You can't be holding heavy trays, like even doing things like refilling ice, like all these things you have to do in a restaurant situation. Like that's going to be one of the longer ones. And same thing with like grocery store work. If you can't just do the checkout, like the checkout you could probably do, within a week or so of surgery.
The bagging.
Yeah. Do they bag anywhere in grocery stores anymore? I guess I'm so used to always doing my own. Yeah. And I mean, there's barely even checkout people, but either way.
Yeah.
Being like feeling pretty good, like being able to do emails and that kind of thing pretty much right away. Driving, you can drive after your drains have been removed in most cases and you've been off of prescription pain medication for at least 48 hours. and muscle relaxants.
So what about week 2 to 3, Amy?
So things are getting better. Weeks 2 to 3, you have more use of your arms. You can have an increased range of motion. All your staples, everything's out. You're feeling much better. You're going to continue with your compression and return to some lower body exercise. 2 to 3 weeks, like especially, if you can go to a gym where you have machines to use, like there's no reason why you can't be doing some lower body exercises.
Yes, yeah.
Things where you're not having to move or transfer weights.
People usually like to continue compression around this time. It makes them feel better. It's not absolutely mandatory, but it definitely makes them feel better.
It keeps the scar from rubbing too, which is why I like people to continue wearing compression like up to that 1 month mark, because the less you can do to irritate the scar, the better. So having that compression just as like a nice smooth surface in between yourself and the scar also keeps it out of the sun. Like there's a lot of benefits of keeping your compression sleeves.
Yep.
For sure. Weeks 4 to 6, you're pretty much back to most normal activities. There's still probably some things that just are not comfortable, especially straight overhead.
Yeah. I mean, so if you're going to do a brachioplasty, you better damn well hope that surgeon makes it tight enough to where you put your hand over your head, it's tight.
Yeah. For a while.
For a while.
Yep.
So you want to get your money's worth too, right? So those super extreme movements, hand over head,
like pull downs.
Like if you really took your arm back behind your back and back up, which I have such terrible shoulder mobility, but you get the idea. Those kind of things should hurt.
Yeah, like things like hooking your bra. Like if you have bras that hook in the back.
That's actually a good one.
Yep.
Yeah, that would be.
That can take a while to be able to do that.
I'm actually doing it right now.
Me too.
My bra.
Yep.
Yeah.
My bra does hook in the back.
Thank you for telling me about that.
So you might be able to start topical scar treatments around this time because of the length of incision with brachioplasty too. And again, your surgeon's always gonna be the one to default to. You want to make sure that incision is really well healed before you start putting anything occlusive over it.
Right.
So that could trap anything underneath it. Until then, we have our patients use a silver gel that really helps with wound healing and just kind of scar formation in general. So definitely follow your surgeon's recommendation on that. Week 7 and beyond, I mean, at that point,
love your results, man.
Yeah.
Keep it out of the sun.
Yep.
You're going to use the scar cream. Lasering can be very helpful. It depends on how your scar looks. A lot of our patients don't even need lasering. So if you go to a place and they're like, oh, you should really do laser afterwards, ask them if you could kind of reassess after surgery to see how you're healing, to make sure you don't purchase a laser package that you may not use.
Yeah. Or that may not really be all that beneficial. I mean, again, the best thing you can do for scarring is picking a good surgeon.
And also keeping it out of the sun.
Yeah. Well, number 1, though, is pick a good surgeon. Number 2 is actually keeping it out of the sun, which is pretty easy to do with this incision.
Yeah.
And keeping sunscreen on it as well. So resuming all regular exercise and activities with the caveat, I always tell patients, like if it hurts, don't do it. And that for a brachioplasty, there might be some things that are not comfortable for an even longer amount of time, but it's important to kind of not push past that because you've spent all these weeks recovering. Last thing you would do is go into the gym and start doing super heavy pull downs and stretch out the side before. I mean, if it hurts, it's still healing.
My friend was telling me about I don't know if you've ever done this, Nils, you may have, where you just hold on to the bar and see how long you can hang.
A dead hang. Yeah. We used to do that in boxing all the time.
Oh, is that
or with Courtney in his torture sessions? Yes, and he'd have you make you hold a weight in between your legs while you did it.
He was saying 120 seconds or something was a lot. I can hang a lot. I can definitely hang a lot. But it was funny because it really starts to pull on your arms.
Yeah.
I could see if you had a brachioplasty on that. I don't know when you'd be getting back to that.
Right. That might be a while. Yeah.
It's weird how you feel heavier and heavier as the time goes. You're like,
your hands get slipperier and slipperier.
Well, so I text them afterwards. I'm like, is there rules to this? Because if you're hanging, and especially if your hands are kind of reversed, supinated, you can kind of pull up and then go back down. So you can get a little bit of a break.
Yeah.
Which I did not do.
It's easier to hold myself up if I'm bent a little bit, because when I'm just hanging with extended arms, my arms get tired really fast. But if I can kind of crunch into a ball, I can hold that for a while.
Right. Well, I'm more talking about even if it's just your bibiceps are more engaged, as opposed to.
Yeah.
I don't know. I did it both ways. He didn't know the rules, and I didn't look it up on the internet. So there has to be a hanging challenge. Maybe someone can comment in our comments and tell us what the hanging challenge is.
I'm not going to do it.
Do you think chin-ups are easier underhand or overhand?
Underhand.
You too?
Oh yeah.
Okay.
For sure. Yep.
I've met
In fact, I think the easiest way to do them is with a V grip.
I think they're lying. People that say overhand is easier, I think they're lying.
I don't know. Some people just have weird muscles or structure to their
underhand
arms.
is so much easier.
Yeah.
Crazy big lats.
So easier.
Yeah. All right. Well, that brings us to the end of part 2 of brachioplasty. So now you know everything you need to know about brachioplasty.
You're so smart. You know this whole surgery.
And if you have more questions, you go listen to our myth episode.
Right here.
brachioplasty myths.
Yes.
Which is the biggest tongue twister of all time.
Because myths
Brachioplasty
is a very difficult
myths.
word to say for Amy.
Yeah. So Dr. Martin, you got any final thoughts?
No, I love this surgery. I said it last time. Please watch part 1. It's excellent. Like these videos and subscribe if you haven't already. But I thoroughly enjoy brachioplasties. It's definitely one of my interests. But I mostly enjoy how happy the patients are. If you're out there and you're struggling with your arms and there really is nothing else you can do, body tight with lipo for most cases is not going to be enough. External laser, not enough. People are going to write questions. What about Morpheus? Not enough.
What about Renuvion?
What about Renuvion? Not enough. So none of these things are going to make enough of a change to affect your arms. Every now and then I'll do body tight in the arms, and I have examples of that on our website that look pretty good. But those people don't need brachioplasties, right?
If you need a brachioplasty, that's the only option.
So basically, if you're a candidate for a brachioplasty and someone has said that to you who's a good surgeon, that's what you need. Nothing else is going to work. And it's hard to say that sometimes to patients because they just don't want to do it. There's an aversion to the scars, aversion to the recovery, aversion to the idea of pain. And it's your arms and it's visible. But once they can get through all that stuff, these are some of our happiest patients. Really, really happy. And it's an extremely transformative procedure. I have people that come in with fairly normal body contours. They don't have a lot of laxity of skin and soft tissue on other parts of their bodies, but their arms are a disaster.
They're not a disaster.
I say that with peace and love. And I love them. And you can like snap of a finger better. And those kind of surgeries don't come along all the time.
Cool. So if you've made it this far on the video, we really appreciate you hanging with us this whole time. You're hanging as well as Dr. Martin can hang. If you would like to leave us a voicemail or text, you can do that at 303-630-9038. And all of our social media handles are below. We are everywhere at Beauty and the Surgeon Podcast and at Jason Martin MD. And we will see you all here next time.
See you later.